are curious, always searching for the truth. Great minds, come let us reason together. Great minds, come let us reason together. Come let us reason. Great minds, come let us reason together. Great minds, come let us reason.
Oh my goodness, great minds. We are here again. It has been a long time, a while, since we've shown a beautiful and one handsome face among us. And we move on. Welcome back to the Young Adults Real Talk, from a place where great minds meet to talk about great issues, real issues in today's Christian society. We start this show in the name of the Father, Son, and Holy Spirit. Amen.
Amen.
Man, it has been a minute, Sinclair. It has been a while since we came live. How are you doing? Let me ask you first.
By God's grace, I'm doing well. I can't complain. It looks like we took a long nap. Some of us needed it more than others, so I am grateful to be back. I'm excited for today's show, and we have so much in store this season. I cannot wait to share it all with you guys. So thank you all. Wonderful to be here and to be your co-host once again.
Your co-host.
Yeah. I mean, I would say guest, but Patty decided to take a hiatus, and I told her to just keep staying there. So I just claim the co-host now until she comes back.
Yeah, I'm glad you've claimed it now. She's on probation now. So let's say when she and Abby decide to come back. Hello, Abby and Patty. We'll talk about it later. But I'm really excited. I'm really excited about this afternoon because it has been a while. And since we are coming back from our break, we needed to bring amazing people as always, people with great minds and beautiful ladies. Today is beautiful. I mean, you see 3 beautiful ladies. I said I don't want to repeat myself, but I just had to. Yes. So I'm going to introduce them and then we get it moving. We have this lady coming back again. I don't know how many times she has been on Great Minds. It's like sometimes you come up with a topic and these people names come up, right? It just pop up like that, and you have to ask them if they are free. And she was like, "Yes, put me down." This time along, then she didn't say, "Let me check my schedule." She said, "Put me down." So I'm really glad we had to put her down. None other than my own sis. She actually ran away from us, but it's still the doing of the Lord, actually. Mrs. Endurance Ejaba, all the way from Iowa District. Hello, Miss. Hello.
Hi.
Looking beautiful.
Thank you.
My husband said all the glory is working. So I didn't want to put myself, but the glory, I just want to get in trouble. And this lady, today's her first time coming on Great Mind Show.
Really? Are you sure?
Today is the first time.
Oh, okay.
Wow.
Yeah, she also left North Carolina. She just left with her husband. They are back. Like, we pray that whoever comes here, you go, do whatever you have to do, but you always have to come back. That has been our prayers, and she's back. Our sister, Dr. Priscilla Tutu Mensah. Hello. Here in North Carolina. Here. She's back home. Here in North Carolina. Sinclair, back to, and you are in North Carolina too, Sinclair. So that's
good. Yeah. They kind of trapped me. So I left New York, and I was like, it's too cold over there. So I'm staying. Yeah. Plus, this is the only place you can have the beach and you can also have the mountains simultaneously. So you gotta love it. So, but before we get really into it, I would like to ask you guys an icebreaker. Now, I had a couple on my list, Some of you are laughing already, because
We don't like icebreakers.
yeah, they don't like icebreakers because they have no idea what the icebreakers are, right?
Yeah. Yeah.
And I was gonna make it easy, like, if you were trapped on a deserted island, what is the one food you have to have? But somebody kind of challenged me right before the show started. You know what I mean? So I was like, that's just way too easy. So I was like, okay, no, it's not that hard. I promise. We'll start with the lady E, endurance. Let's see. What is your go-to for de-stressing? What is the one thing will always work for you? Letting your husband massaging your feet, or you telling the kids get away from me, whichever one works.
Telling the kids to get away. Mommy needs a break.
Right.
That, and then most importantly, prayer. To be very honest, can't go without that. But yes, and then also telling the kids, mommy needs a break. I
Mommy
need
needs
me time. Yes.
Yeah. What about you, Dr. Priscilla? What's the one thing really helps you, get de-stress?
Yeah, for me is music, and it has to be worship music. So worshiping just in my closet without the kids. So
Not the kids.
Why are you doing that?
I know everybody's like, forget the kids. It's like, I think they call it the FTK club. Forget the kids. Just nobody wants kids around. I had to kick mine out just before we started this because he wanted to sit
Well,
on my lap and do
same,
the whole show.
same. Yeah.
So, like, why not, Daddy? Not now.
Yeah.
So, Justina, since you're so beautiful, along with the wonderful panelists we have, why don't we
you're
ask
so
you the same
sweet.
question? What do you do to de-stress?
Distress. Music. I mean, just listening to music, and most of the time I just don't even know the lyrics. I don't know the lyrics, and I try not to learn the lyrics at that moment. I just want to listen to the bass in it. For whatever reason, the bass in the music sounds different in my ears. So I just listen, pay attention to the bass, and then keep it
Okay.
moving.
Wow.
Worship song, yeah.
Worship song. Okay, because I was gonna ask you because the same thing for you too, Dr.
Yeah,
Priscilla,
it has
the
to,
worship
yeah, it
song.
has to be worship. Yeah.
It has to be worship.
Yeah.
I'm still with the keep the kids away. That works for me. It doesn't matter what I do after that. I can be by myself, singing to myself. All right. So let's get into it. So today I'm very excited, and also I think is an important topic that we're going to discuss today. So for anyone who is watching, I welcome you. Let me start by saying this. Did I do the disclaimer already, or that's not right now?
What are we talking about?
Oh yeah, we should start with that, right? Okay. So
I think your probation is over.
I told you it was a very, very good nap. Today, our topic is mindful journey. The mindful journey approach to mental health is on teaching children mindful practices that promote self-awareness, emotional regulation, and resilience. It encourages children to be present in the moment, understand their emotions, and respond thoughtfully rather than react impulsively. Mindfulness not only helps children reduce stress and anxiety, but also foster empathy, concentration, and a sense of inner peace, setting the foundation for a long-term emotional well-being. Today, we're going to dive into mindful journey. Justina?
Mindful journey. Mindful journey. Okay. And your disclaimer. So the following conversation is not tied to any specific church, but our focus on the Christian society as a whole. This month, we all know is Cancer Awareness Month, and it's also mental health in children. And that's what we want to focus on today. These are the topics and conversations that you normally don't hear because of the stigma attached to it, because people really don't have a lot of information about it. So we don't hear it in the community, unless I heard I I started hearing it and also doing a lot of research online. I saw one video where a mother actually came out to talk about the challenges that she's facing with one of her kids. So that's what we want to talk about today. And we do have we have So let's ask them for them to give us a little background. So when they talk, you know why we have them here. So I'll start with Lady E. Can you give us a little background about your profession, what you do, and that ties to today's conversation?
Absolutely. So, professionally, I have my master's in pastoral clinical mental health counseling. And I've been privileged to do a lot of mental health work. Right now, I'm not practicing, being in the role of suffer mommy now, and helping out pastor. But prior to that, I've had a lot of experience in working in the mental health field, working with children with mental health, um, so on and so forth. And so this is actually a very dear topic to my heart. Um, because as Justina said, it's not really talked about, especially in our community, right? And so being in the field, being in the profession, and having sat down with a lot of kids with mental health, and as we get deeper into the conversation, I'll share my thoughts on that. But just having experience in that, I'm just super excited to be here and just share information with the group. Thank you.
Thank you, Lady E. Thank you. Dr. Tutu Mensah.
Hey, so my background, um, I have a medical doctorate, so degree, but I'm a family medicine board certified. So I see we joke is like from cradle to grave. So we take care of children all the way up to adulthood. So yeah, I've diagnosed mental health, diagnosed behavioral issues or problems. Um, and so, but yeah, I agree with Lady E. It's a topic that I like to talk about and I like to shed more light on because in our community, we don't talk about it. We don't even bring it into the conversation and we tend to wait till it's a little bit too late to have certain interventions be put in place. So I'm glad to be here and to talk and discuss and just to disseminate the information and get people talking.
Thank you very much, and Lady E. Yes, these are some of the topics that you hardly hear about in our community. So I'm really excited that you both are here to help us understand what goes on with our children. And if I do believe a lot of parents are watching, and if you are watching, please do call a friend, call a family member that to come and listen to this conversation, these discussions. And I do believe by the time the show is over, we will learn a lot of things. My question to you, first question will go to Dr. Priscilla. As a family doctor, how do you assess mental health during routine checkup? How do you assess mental health during routine checkup? We just want to build a foundation on how, for parents to understand how doctors are able to diagnose and assess all these things.
Yeah, so and specifically for like children up and like even teens, and even young adults, we always screen whenever you come in. So it's a standard question that the nurse when she's checking you in, she will ask the parent if they are um, under the age of 13 or 11. It depends on how independent the child is. But usually we're very we cue into like nonverbal communication, so like even if the nurse notices something, some dynamic that is not normal, then she'll alert me. But I also, when I get into the room, I also ask, and then if they're a teenager or depending, usually I go as low as 10 years old, but it just depends on how independent the child is. I will separate the child and the parent and ask personally, making that a safe space for them to open up to me. And if there's anything that the parent needs to know, indirectly, kind of talking about it with the parent, but unless it's like, um, you know, they have thought like they have a plan or thought of harming themselves, then I do have to let the parent know.
I mean, so question though, follow-up question. You say you assess them by asking them questions, right? And through that, you're able to tell or determine if this child have any mental health thing going on. You know how these kids are. Sometimes they just can just say anything. So does it take only one um, check up that you determine this child have this mental health, or it has to be like subsequent ones that it has to continue for you to be able to
Yeah,
finally say this child have that?
I think it depends on the situations. There have been times where it just took one time. Like I didn't
Mm,
need subsequent visits. I just knew. And then there's some times where I did need that time. So like it may be multiple visit, or maybe I maybe have seen that child for years, and then maybe
okay. Okay.
something happened in their life, and that took a change. So it's a bit of both. Sometimes you can recognize it and identify it right then and there. Sometimes it takes time. And then, and most importantly, building that trust with that child. Maybe you might notice it during like one visit, the first visit, but they might not be comfortable sharing that with you. So, like, maybe reassuring them that, hey, when you come to see me, this is a safe space. You can open up about anything. You have my confidentiality. I'm not going to tell your mom, or because sometimes they're just scared
Yeah.
about other people knowing, or being labeled. So it's just building that rapport, reinforcing that, and reassuring them.
Mm. Hmm.
Well,
Lady, go ahead, Sinclair.
no, it actually leads me to the next question, because I was thinking that in your form of like assessing the child, and I'll direct this question to Lady E, because it's like a lot of us, when we have a child, and we, even as a parent or even as someone who's a counselor, and you're talking to them and you're asking questions, some parents disposition is simply that, oh, that's just how they are, even if there's an underlying cause, right? So Lady E, how do you differentiate between a health disorder and behavioral problems in a child?
Right. So I wanted to say something to what Dr. Susu said. With us as clinicians, we're also trained to use our best judgment when we come across children, like, with mental health or behavioral situations. And so it's just very important that as a clinician, you're very intuitive, you know, um, with the assessment, the questions that you're asking, being observant to how the child is presenting, how they are, like you ask about behavior wise, how they're behaving, and so on and so forth. And just really just really using your clinical judgment, to decipher, is this really mental health or is this more behavioral? And so that's something I wanted to touch on. I'm glad you bring in this question. In dealing with children, I personally, and Dr. Tutu may have her her opinions. Honestly, I really always think a lot of things with children are behavioral, that needs to be nipped in the butt. Excuse me for saying that, but needs to be dealt with, from the onset. Which, if not, then eventually it gets to that mental state. It becomes so severe that it becomes to the mental state. So I'm not saying that I don't believe in mental health in children, but I just really do believe that a lot of things are more behavioral, attention seeking. You know,
Mm-hmm.
there's something missing in that child's world
Yeah.
environmentally. There's something missing, and they're seeking for attention. And if they're not getting that attention, then whatever they're going to do to act out, they will act out, right? And so that's where ADHD come in. The
Yeah.
child can't sit down and focus, so on and so forth. Um, so just to answer your question, Sinclair, just being very, just really putting on your clinical hat, and based off of the assessment that you have, using your best judgment to decide, is this child really having mental health or is it behavioral? Now, I do also want to clarify. So what happens is, on my end as a mental health clinician versus Dr. Tutu, most of the times I will get a referral from Dr. Tutu, right? Because Dr. Tutu has already seen the client, given them the diagnosis, and then that's when they come over to me, right?
Okay.
Yeah. So I always like to clear that when it comes,
Yeah.
when we have to differentiate the difference between the doctor who can make the diagnosis, so on and so forth, and then us, the mental health clinicians who sit down and talk, get to the root of their problem,
Right.
right? Which then helps you to understand it's more behavioral. This child just needs something, some
Yeah.
attention, something before all the medications and everything else come in. So I hope
Okay.
that kind of answers your question a bit.
No, no, it does. And I want to actually piggyback to Dr. Tutu. So have you ever heard back from the clinician basically saying like, hey, your assessment of the child was maybe overlooked, or was it incorrect, or whatever you saw was not necessarily what you thought it was? And if that's the case, how do you relate that to the parents?
Yeah, so when I make the observation or diagnosis, there's certain things that I can really diagnose like right off the bat, like depression, anxiety, ADHD. I have my own screening protocol for ADHD,
Gotcha.
and when I do and when I don't prescribe medications.
Mhm.
Um, but when it comes to like where the line is kind of gray. So, like, I'm not sure whether this is just behavior or is it stemming from a trauma? Is there something in the home that is causing this child to lash out and act like this? Or maybe I've been taking care of this child and they are the sweetest, but then they turn 10 and it's like, something is off. They're starting to be rude. They're starting to be this. And it's like a cry out for help, is what I try to call it. And so, like, when I'm not sure and there's a lot of gray, so it's like, is it bipolar disorder? Is it personality disorder? Is it just a cluster of personality that makes them? Are they antisocial? Is that, because they're, maybe the parent is like, oh, they're burning things in the house, they're torturing animals in the backyard, like all these things. Like, when I see that, then I tap into like my mental health resources or my mental health clinicians. And I say, maybe I'll say, well, maybe this one, I feel like it needs more peeling back of the layers that are going on. So I think they would really benefit from a counselor, right? Or someone who
Okay.
they can talk to, who they can trust, they can open up to. So then I would send a referral there. If I feel like it's more of like a antisocial, like behavioral personality disorder, then I'll refer to a psychiatrist to
Gotcha.
do some more digging. Because I feel like that is more, that is just the personality. Like, there's
Okay.
no amount of like talking to and medications that I can prescribe that will change that individual, because that's a given personality to them and that's how they are. And so, like, with that, I sent to psych because um they have other ways of dealing with that, and maybe they will prescribe medication, but it's just
Gotcha. So, I'm sorry if I'm staying on this topic because I'm trying to dive more into it. The reason why I'm saying that is because so you're it's not that you're trying to get it right or wrong as in the way that I first
I know.
previously stated. It's more
Mm-mm.
that you're trying to make sure you don't miss anything is
Correct.
why you're okay.
Yeah. Like,
I,
as a physician, I don't mind be wrong. Please tell
right.
me.
Thank you, Dr. Tutu.
I just want to do what's best for my patient, right?
Understood.
And so, like, I know my limitations as a clinician. Obviously, I'm not psychiatry, right? So I know where my limitation stops, but I am the front line for finding a lot of these mental illness, mental diseases, behavioral problems, because they
Right.
come to me first, right?
Mhm.
And I'm like
Okay.
the gateway to the resources in the
Right.
community. And so I have to know, and like, like Lady E was talking about, like, you have to have that best clinical judgment, and it comes in all forms, but most importantly, your intuition and that is like what builds your clinical gut, and that's why they call it the art of medicine, because
Mhm.
everybody's artwork is different. That's why every
Mhm.
doctor you go to may be different, um,
Mhm.
interact with you differently. So with me, it's a lot of, I did psychology in undergrad, so I I like the people aspect of things, and I've learned over the years that most things people tell us through their body language
Gotcha.
Mm.
and not so much their words, right?
Hmm.
Oh,
Um,
okay. I have a question going back to the diagnosis. What is the age, like the youngest age that you like as a doctor you diagnose? I have two questions, and I'll go to Lady E. That you diagnose of mental health, because like you are saying, these kids, every child is different. I mean, I know me growing up, breaking plates and all that. That I
yeah.
was little, people playing outside outside, Justice jumping. Oh, Justice, I'm sorry. Like real, like I know my brothers. So these kids have different behaviors. They have different energy and all that. So at what age will you say, okay, this child do have mental health, knowing they are just a child? They will just they will explore. You know what I mean?
Yeah, so I just want to clarify it. Every situation is different, right? So,
Mm,
um, if we're talking about, maybe behavioral things that parents notice during the developmental age, like autism spectrum things, that would be diagnosed way earlier, right? So, like, we screen for that starting at 18 months of age. And if we have some concern, we may repeat testing. So, that's that. But usually, and maybe if someone has been in some traumatic situation, that anxiety or that depression may manifest a bit earlier. But usually it's school age kids and above, because once they enter the school system, they're interacting with others, and not just their parents. So, like, someone may notice something or different, or they may react differently. So
okay.
I say my youngest, since we like ADHD, let's me bring ADHD. My youngest ADHD patient uh started seven, age of 7.
Okay. Okay. Wow.
Yeah.
Wow.
Okay.
Lady E, there's a question in the chat. It says, as parents, what are some of the things that we will need to look for in our kids to identify these issues?
Would I be able to touch on a little bit more to what Doctor was saying
Yes,
before?
yes, please.
Yeah. So
Yes.
with the age, so the last facility I was working at, we saw children as early as 4.
Mhm,
However, they were not. They didn't have diagnoses.
mhm,
And our facility, we don't diagnose. Like I said, most of the
Okay.
times they'll be coming from Dr. Tutu to us already with the diagnosis. But we see them as early as 4, but then we would then refer them out, as doctor was saying, to higher level of care if any diagnoses needed to be made. Um, but back to the question, and Sister Justina, can you ask the question again?
Yes, it says, as parents, what are some of the things we will need to look for in our kids to identify these issues?
Yeah. So, I mean, when you think of kids, they're happy, they're playing, they're social, they're engaging. And so anything outside of that, they're being antisocial, like Dr. Priscilla said. They're disengaged. They don't want to do anything. They want to sit in front of the TV the whole time. And then, if you try to intervene, they're throwing tantrums.
Mm,
Aggression is usually very high with children dealing with behavioral problems or mental health problems and things like that. So those are some of the things that as a parent you want to look into: their aggression, their disengagement, the fact that they're not socializing, so on and so forth.
wow. Before we even get into it, because I know there's a lot of questions I have in my mind. Dog, and then comes to, well, let me say with Lady E, what is your definition of mental health? Because I know when we say mental health in children, it's a lot. Can you, speak a little bit about, like, within a minute, to define what mental health is actually about?
Yeah, I would say mental health is anything that impacts your mental state of being, that then influences your behavior and then your mood, right? And so in mental health, we're dealing a lot with mood disorders. Dr. Tutu mentioned depression and
Mhm.
anxiety. Um, it can get as worse as suicidal ideations,
Mhm.
bipolar, so on and so forth. So anything that is impacting your brain from just being at a place of peace, a place of calm, and then it has you, your brain is just all over. It's impacting your behavior, how you eat, how you sleep, whether you're even doing those things or not. And then once again, it impacts your mood. The fact that you find yourself in a place of depression at all times, you don't want to do anything. If you're eating, either you're not eating at all, or you're even overeating. Um,
Mm.
yeah, so that would be my definition of it.
Mm. That's
Wow.
deep.
Do
I
you
know.
have anything to add on that, Dr. Tutu?
No, I mean, I think Lady E hit it on the nail. I mean, mental health is packed.
Yeah.
That one word describes so many things. And I like to think of it like as three pillars as a clinician. How are their emotions? How is their mind, their thinking, and how is their interaction with the rest of the world, right? And that's their well-being. So you have to have emotional well-being, psychological well-being, social well-being. And in the site or in the time of stress, how are those things being challenged? How are those three things being challenged? And how it pretty much like you said, like how are they choosing to interact with the world based on those things that have been impacted?
So in a way, you can literally say that everything runs on your mental health.
Yes,
So
absolutely.
so just about anything and everything can be associated with mental health.
Yes. Like physical disease can affect you.
Right. I mean,
Yes.
that's a
Everything.
lot bigger than most people would think, right?
Yes.
Because we there's a lot of things that happen that we don't associate to mental health, and we choose not to talk about it because we think it has nothing to do with it. But judging
Right.
by how both of you are defining it, that should probably be the first place we start, correct?
Yes. Yeah.
Wow. Okay. So with that in mind, there's also a lot of stigma that is, around mental health. I'll start with Dr. Tutu, and then I would like Lady E to chime in as well. How would you then define the type of stigma? What is stigma? The type of stigma that has to do with mental health, and some of the stigmas that you yourself have encountered.
Yeah. So stigma is when I honestly feel like stigma stems from not being able to understand something. So not knowing the unknown. And because it's different from something, then we shun it away, right? Because it's not the norm, it's not what we see every day in our circles. So because we don't understand it, we don't recognize it. We also sorry about the background
No,
noise.
yeah,
They're making their contributions.
yeah, they are. They want to see how this affects your mental health.
But yeah, so like I said, it's because we don't recognize it, we don't know what it is, and it's not something that we're familiar with, so we shun it away. So that is stigma. So
Right.
isolating something or someone because one, you don't understand it, it doesn't look familiar, and you don't want any association with it.
Mhm. Okay.
So that's stigma. In terms of like um mental health, the stigma behind it is like I think everybody wants to be strong, right? Or
Mhm.
wants to be recognized or seen as being able to handle their business, right? So
Right.
Mhm.
the world that we live in. And so like if you can't um do that, then it's like, oh, I'm not enough. You start questioning your worth and your value. And that snowballs and you start thinking about other things. But usually, but yeah, that is pretty much what it is. It's a stigma because everybody wants to be seen as they're okay.
Right.
And there's nothing wrong with me.
Right.
Yeah.
So yeah. So it makes it hard for someone to come forward because they don't want to be seen less than.
Gotcha. All right. Lady
Yeah.
E.
Yeah, they don't want to be seen as weak. That's the word that came to mind as Dr. Tutu was speaking, which is so true. And I just wanted to give my definition of stigma really quickly, right? It being the myth,
Yeah.
behind, and in this case, in mental health, mental health is not real. Um, oh, you're just being too emotional. You hear statements and comments like that. You're being weak, right? And then these things, as we're talking about children, it starts we start making these statements to them as early as them being children, right? Especially with our young boys, right? Toughen it up. Don't
Yeah.
cry. Men don't cry.
Oh,
Mhm.
yeah.
All of these are stigmas,
Don't
Yeah.
cry.
in dealing
Wow.
with like I said, in my work with children, and especially with young men, I'm like, if men didn't cry, God would have not put cry buds or whatever
Tear,
tears
tear duct.
under their eyes to begin with, right? And Jesus wept, right?
Yeah. Yes.
So
Yeah.
we start we make these comments to them as early as them being young, and so their little mind, processes, or I need to toughen it up. I can't express my emotions,
Mhm.
and so then what happens is that all that gets balled up inside, and then all of a sudden there's that exploding. So stigmas of mental health is real, and especially for us, our African community, right? Which,
Yeah.
yeah, we don't even want to talk about it. It's not real. Oh, there's nothing wrong with you. We're so quick to sweep it under the rug as opposed to processing the person's emotions, as opposed to processing how the person is feeling and whatever it is that they're dealing with, which is where I will come in the counseling side of the mental health world. So stigmas are there, and I think sometimes we ourselves, especially when it comes to our children, we project certain things on them. We don't know how
Yeah.
much we're doing it, but we do it, and
We
then
do.
all of a sudden they grow up and that's I'm depressed, I'm this, I'm that. So yeah.
I
Mhm.
mean, I remember Sinclair and I had a conversation when we were talking about mental health, I think a while ago. We were talking about, do Africans even get depressed? You know,
No, no, we
that's,
don't.
You
Yes,
can't.
No,
we
that,
We're
do.
that
not
is
allowed to.
you know what I
we,
mean?
we don't.
Is it a
Yeah,
Do we get
taboo?
We
depressed?
hide it. We
no.
hide it.
Is it
Africans
It's like,
taboo?
we do
get
not.
depressed. We don't get tired and we don't get depressed. Okay, those are the two
Yeah.
things. You know that,
It's like
Graf?
like a taboo in
It's a
African culture.
taboo.
Yeah.
Yeah. But let me ask you this, doctor, and then we go to Lady E. What are some of the strategies that you can get patients and families who are reluctant in seeking for help? Like we just talk about depression, kids. I mean, I'm just thinking, I mean, at what age will you know they are depressed? And how will you be able to get them talking or, to seek help? Because, like Sinclair mentioned earlier, as parents, you don't want to accept that your child had this, mental health, or your child is going through this kind of things, right? How will you get them seek help without feeling this stigma that we are talking about?
Um,
Yeah,
do,
it's for you,
oh,
doctor.
it's me. Honestly, as a parent, I think it starts by creating that safe space for that child. So, um, I guess I'll use myself. I'll put my parent hat and then I'll go to the clinician side. But as a parent, I tell my kids, like, especially my 4-year old now, that um, if this is our safe space. So like if you come in here and you close the door, I know that I need to stop everything that I'm doing and listen to what you have to tell me in that moment because I've created this room as our safe space. where you can tell me anything, and I promise I will not be mad at you. I will not judge you, and I will not like react angrily to you. So for them to know that it doesn't matter, they can come to me anytime, right? And so that's
Yeah.
like the same concept that even at my job I use is to create that safe space for my patients. Um, that they feel comfortable enough to ask me questions, that it's not that I am so high up, or maybe my doctor doesn't have time for me to open up about these things that I've noticed. So and as a parent, I feel like there's no age, honestly, that you just have to be vigilant, and just know your child. You know your child, and like
Yeah.
when there's a change, or even as a mom, you have that intuition. Something is wrong. What's wrong? They may not even be crying, but it's like that they're not acting like themselves. So like being able to recognize it, like I say, I'm stressing on this today, but it's like nonverbal cues. Like, what is their body language telling you? Like, is that your normal child that you see at home?
Mhm.
Um, so yeah, safe space, safe space.
Mm. Sinclair, safe space.
Yeah, safe space. Lady E, do you make the same safe space, or do you do the African thing?
What is the African thing?
Right
Exactly. What
after I
is
introduce you, I will tell you exactly what the African thing is, because that's what happened to me.
Yeah, no, but yeah, doctor have said it, and that's part of our training, right? To create safe space, like Dr. have said, and being present with the child. And from my background and experience, if the child does not want to talk in that moment, it's okay.
Yeah.
Not even just the child, but any patient
Mhm.
that you get into your clinical space, if they're not ready to talk, it is okay. Now the thing with children, for the sake of our conversation, because they're minors, they're always going to have a guardian with them, right? They're always going to have a parent or a guardian. So, for the most part, if a child is not ready to talk, then the guardian or the parent, is the historian of the child, and they can provide information. But if a child is not ready to talk, you can't force them. You can't force them. And so your role as the clinician, once again, like my dear sister just said, is just that creating that safe space, letting them know it's okay, letting them know that you're there for them, practicing and engaging in empathy with them, and then just being hopeful that depending on how many sessions you're going to have with them, they can share some information with you. But for the most part, you just can't force it. And then you can get information from the parents as well. I hope that answers your question if I understood it proper.
No, no,
I,
that was wonderful. That was perfect. But I'll tell you the African thing. So, and this everything you're saying, I'm listening to it, and I want to have a pushback on both of you, because all of us here somewhat
We
are
grow up with that
okay.
environment.
we we are all of the mindset that mental health is important. It's the reason why we're doing this show to begin with, right?
Yeah.
But I want to come from the perspective of someone who don't think about it, who has no understanding of what mental health is, because as an African parent, or most of them, the ones that I've had the privilege to know, I'm not going to point my parents out here to dry, but
Throwing them under
it
the
is.
bus.
I know they're watching, I'm sure. Is do as I say, right? Not as I do, right? So even when the child wants to basically even communicate, there is no, as you guys consider, safe space. So for that parent who has been entrenched in that type of mindset, how do you then go about in educating them about what it is, and then give them the tools to be able to seek help for their child when they themselves have no knowledge of it?
Can I answer
Yes, please.
before
Yes,
Doc comes in?
lady.
No,
Yeah.
please go ahead.
Yeah, so I think that's what we're doing here when when we have these kind of discussions, and then a question like this comes up. I think what we're doing here answers that question, whereby we're shedding light, and we're being hopeful that hopefully it will help to change certain perspectives
Hmm.
and certain ways in which, like you said, our African parents have dealt with some of these things, especially us young African, you know, this young generation of African folks being parents, coming to understand how some of these things actually impact our children, and just using psychoeducation, which is what we're doing right now with this platform. We're providing psychoeducation on this whole topic and teaching that A, B, C, and D can cause this and this and that. And so, therefore, this would be a healthier way
Hmm.
to go about it, creating that safe space, allowing your child to communicate, showing them by example, as opposed, like you were saying, is do as I tell you and not as I show you, but it should be more of leading by example, So as we're doing these kind of things, having these kind of conversations, it is the hope that hopefully, somebody will catch something, some
Mhm.
information, and be able to then apply it and use it. So that would be
Okay.
my take on that.
No, that was beautiful. Mom, Dad, if you're watching, this is what you. Um, I'm, gonna- I'm gonna come. I know my mom is gonna call me as soon as I'm done with this. I will go to the pushback now with Dr. Tutu. So
Mhm.
just recently, I was talking to my mom, and I told her that I was actually okay with the idea of do as I say, not as I do. My
Mm.
only issue as a child was I felt that I was misunderstood by everyone, only simply because I will do it, but can I at least tell you what I
Right.
wanted to do instead?
Mm.
And there was no room for that discussion, right? You want me to sit down, clean my room, whatever? Okay, fine, I'll do it. But can I tell you what I was going to do instead and my reason behind it? And nobody gave me any room to share that. So for me, it's like, yeah, they think they know me, but they don't really know me, right? And it was a shock to my mom to hear that, because she was like, I never knew that that's how you felt, right?
Yeah.
So because I'm thinking now as a parent, if I give you that room or the safe space we're all talking about, and I'll allow you to go back and forth with me, which I do with my son, we now spend 15 minutes something that
Telling
is
you or
extremely
something.
small. And I'm thinking I should just be my parent right now and just be like, just be
Yeah,
quiet, do it. Because it's the fastest thing to get the obedience. So my
exactly.
question now to you is, how then can you explain to a parent to give them the safe space, but also letting them know, or how then do you not lose the obedience from your kids? Because it almost sounds like you're going to create dissent in your own home.
Yeah, I think I just learned this personally with my kids because I just feel like we, even as a parent, sometimes we forget, like, we expect them to know how to act.
Hmm.
Right. We expect them to know that they're supposed to sit down. We expect them to know that they're supposed to be quiet when mommy and daddy are talking. We expect them to know that, oh, when visitors come around, you don't run around. There's that expectation, but there's no training. Like, so it's like we do it backwards. So like they do the action, and then we're like, hey, don't do that. You're not supposed to do that, blah blah. And
Right.
that's that. You're supposed to learn that,
Right.
right? But it's a training. Like, I was like in scripture today, and I was, it says train up a child in the way they should go.
That's right.
So that means like you need to sit down, have a conversation. Like, these are mommy and daddy's expectations.
Yes.
Hmm.
Like, when mommy and daddy are talking, don't talk. And there's like that first, even if they do it backwards, there's that first time where you tell them, these are our expectation. Don't do it again. There's only one chance. Don't give multiple chances. That's like there. But yeah, I think that's, and our parents, they just didn't have time. I mean, like, let's be honest. Like, they came here from another country. They're working. They're trying to make ends meet. They're really thinking about us, right? And they have us in mind every time, but it's like they're just not present. Like,
Yeah.
they're not
Yeah. Yeah.
present there.
Hmm.
And their way of being present may have been praying for us, may have been interceding for us when, maybe we're down, they notice something is wrong, whatever, but that was their way. So, if a parent comes up from that generation, like Lady E said, it's about telling them that, it's real, mental health is real, or this is real, or, maybe listen to your child, because they want to tell you, right? They see you every time. But if you make yourself inaccessible, right?
Mhm.
There's a difference between like accessibility and then just spoiling the child because you are ignoring all the red flags. There's a difference. I'm never gonna be my child's friend. Like mommy is not your friend. Right? And so like to put on that disciplinarian hat,
Okay.
right? And then do that. It's tough. So, I
It
give
is.
our
It is.
parents grace because going through it's tough.
Okay.
Girl,
Oh, no,
listen.
that's good. Well, I'm sorry I took you guys away from mental health to child rearing. But back on the topic, I want to read a comment from. I think this was in response to what I said. It says this is from Kwesi. It says to Sinclair's point, how many parents do even take the time to listen to such programs to
Hmm.
get this education, and how can we spread the word, because it's important. I want to let Lady E address that, because you mentioned that a program like this is how we basically educate those who are interested in knowing what they can do for their children, right? So how do we do that when they don't even want to watch a show like this, or they're not even privy to such information?
Right. And so I would say, so this program is being sponsored by the church, right? It's being done through the church. So I would say take it to the locals, take it down
Mhm.
into the locales, the smallest or well, where more of the people are, right?
Right.
Yeah.
So as we're doing this on a larger scale, taking it down into the lower scale. I always say now by God's grace, there's a reason why God took some of us in the various professions that we're in,
Yeah.
myself,
Yeah.
Dr. Tutu,
Yeah.
so on and so forth, for us to understand some of these things. And so we have to be that advocate for these young ones, right? And so taking it from the larger scale, this is wonderful. So having it here and then also taking it down into
Mhm.
the house.
That makes
That's what I would
sense.
say.
Please, so when it comes to the locals, please be available. Available no, because I feel like not to deviate, but I feel like sometimes the church will have great programs, but only few people will attend. And these are the people that, kind of know already. They just come to top it up. But the people that you think need it will not be present. Anyway, so not to deviate. Coming back to mental health. I know Dr. Tutu and Lady E mentioned about medication. I don't like taking any medication, but think about little kids, right? I mean, I hate medication. Oh my Anyway, in your opinion, in your professional opinion, I
Um,
hear it. But I have to ask, what
Can
are your thoughts on medication versus therapy for treating mental health? Because these little kids, let's say a 4-year-old is diagnosed of bipolar, whatever, and they have to be on medication for the rest of their life. They are too little for these kind of medications. So, what are your thoughts on? Can we do any therapy beside giving medications?
can I
You
come in
know,
before Doc comes in?
Yeah, go
go
ahead.
ahead.
So Doc is the one that prescribes the medication. And I'm gonna be so candid and real, based off of experience, um, having sat down with children,
Yeah,
having sat down with adults with mental health who have been on medication since they were children.
yeah,
Doc, God bless you all, but I am not for medications
yeah,
just because I've seen so many revolving door patients who are on so many medications, and yet
Nothing's
they're still
happening.
dealing with whatever they were dealing with, you
Mm,
know. However, I always like to say, however, please, for medical purposes, if your PCP, psychiatrist, whatever, have said your child needs to be on medications, by all means, always follow doctor's orders. But I'm just saying that from my personal experience in being in the field and having sat down with children, having sat down with adults who have been taking meds since they were children, who have
yeah.
been dealing with mental health, I'm just like, can we find a different solution? I feel like
Yes.
sometimes some people become overly medicated,
Mm-hmm.
that it even makes the problem even worse.
Mhm.
You know, and even with some medications, the side effects are you have suicidal
Alone.
ideations. You
Mhm.
know, so this is just me, Doc.
Yeah,
This is just
it's
me.
On
okay.
to you.
I will be the bad guy.
Yes, no, it's fine.
No.
But like I said, please follow heed to doctor's orders. I want
Mm,
to throw that in there.
Yeah, I mean, honestly, that's okay. So, as my clinician hat, being family medicine, so children to older adults, I medications have their place.
okay.
Okay, medications
Okay.
do have their place. However, in terms of like kids, since we're speaking about kids alone, we try so hard not to prescribe anything as clinicians. We'll rather see them go to counseling, go to therapy. And honestly, we never prescribe medications alone without prescribing the therapy. They both go
Okay.
hand in hand. So like
Okay.
I put you, but most times patients want a pill that fixes everything.
Really? Really? Fix
Everybody wants a
them?
pill. And
Wow.
so with children is really managing the parents' expectations because they always want just this thing to be gone, right? I just want my child to stop doing this. I just want my child to stop doing that. But the reality of things is that if you know, there's no cure for like, it's more of like it's like a chronic illness. Like if you have hypertension, you will continue to have hypertension. It's not
Right.
that, oh, maybe one day my blood pressure is better. And so that means I don't have hypertension anymore. Granted, God can heal you and cure you. He's the only one who can cure you. But me as a physician, I can't cure your chronic illness, right? And so that comes is the same way as with mental health, but I can help you manage it.
Yeah,
Mhm.
Make
Is it,
it
I'm sorry.
no.
Is it no, because it's like it's a topic that is dear to my heart because is it because we find pills because you mentioned before that most patients or most parents that come in they gravitate toward the
Don't
pill.
know.
Is it
Yeah.
because the pills are more feasible than counseling, or is it because peel is for a shorter duration of time management? For instance, if I come to you and I ask you, my child is going through blah blah blah, what are the options? You're like, okay, well, 6 months therapy with Lady E, or I can give you a pill and I got to give you once a day. Yeah, I'll take the pill. Is it because have you noticed that maybe that's the reason behind that?
No, I think that most people and this society just want a quick fix. So is whether you're taking the medication, you are going to have to take out the time to give your child the medication because you can't just leave it in the child's hands. But it's easier to do sometimes because parents have to go to work. And if you're
Mhm.
going to therapy, we're going to have to take time off to take you to therapy, right? And so, like, that's taking time out of their day. And, I can't speak to everyone, but
Yeah. Yeah.
sometimes medication is seen as a quick way out.
Right.
Mm-hmm.
And
Mm-hmm.
I try to dispel that myth so many times because we know that prevention is better, right? So, like you making that safe environment for the child, you making sure that could prevent them feeling anxious or depressed
Right.
and all that. But once it's there, we need to manage it.
Gotcha.
And honestly, we can't have a positive outcome on that management without combining therapy and medicine. But
Mm,
most time, people just want to do the medicine.
mm.
Do you
See, oh,
think?
see.
I
Hmm.
think Lady E wants to chime in. Go ahead.
I wanted to ask a question if that was okay. I know you all are the ones
No,
asking
no, no,
questions,
No,
absolutely.
no, go ahead. Go ahead.
but I have a question to Dr. Tutu. So then, my question from my professional standpoint, going back to what I was saying, is that why is it that a lot of like clients who've been on these meds for a long time become adults and then they're still dealing with their mental health issues?
Good question. Hmm.
Yeah, I think we forget that mental health. So like if I diagnose you with bipolar disorder, right? That
Right.
diagnosis is for life. It doesn't isn't it's like a chronic illness, like I said before, right? It's there. It's always there. The It's just that maybe your environment does is not stress inducing to bring out, the manic side or the depressive side. You're keeping a well balanced environment around you. You're taking your meds, you're going to therapy. So it's helping you manage those emotions or that psychological disorder that is going on. So like I said, there's no cure for bipolar disorder because it's there. It's a diagnosis, it's a disease, a disorder that is there, and it's gonna be there. And I can't cure bipolar disorder. There's no
Mm,
cure for it.
yeah.
You can only
Um,
manage it.
I can only
I
manage it,
don't manage it.
and that's what people fail to understand, right? So like, if you are depressed, right, and depression gets you to the point that you may need there's different forms of depression. Like maybe it's reactional to the situation that you're going through. So maybe you lost a loved one, right? And you for that 6 months you're having a hard time dealing with it, right? So yes, I can prescribe you maybe an antidepressant, but also going to tell you you need to go to grief counseling to work through the grief and the idea, like having lost that person that was so dear to you. Because the medication, they'll make you feel good for the temporary duration of when they last.
Hmm.
But you being, like I said, mental health is your psychological well-being, your emotional well-being,
And the
and your
social work.
social well-being. So what the therapy does is it helps you manage how your emotion, how you think, and how you react in the world around you.
All right.
And so that is needed for you to learn those um what do you guys call it? Those what is it called, lady? When you teach someone those trick like breathe in, breathe out before you speak.
And
There's a word for those. But I'm
It will
blank.
come. It will come back to that. It will come back to that.
It will
It will
come
come.
back in.
Yeah.
techniques,
Yeah, like so those techniques, just like mindfulness. Mindfulness is a technique that you use
interventions.
to overcome anxiety, right, about something or stress. So those all are techniques that you are taught or tools that you are given to be able to manage your reaction, the way you think, and how you um, feel about things.
Mm.
And so that part is key. Like the therapy is key.
It's
It's
key. Okay, I
key.
want to go to the comments before I.
Yeah.
Um, so one of the comments is from I can never say that name right, but they chime in all the time. I'll just go Jen IM89. It says yes, the magic pill, and then it says parents don't have time to take them to therapy because it takes too long.
I have a
Um,
question about that. I'm sorry.
sure, go ahead.
So, like I said, I don't like pills. I don't like taking medicine, right? So with these little kids, and you mentioned Dr. Tutu that some of the parents will ask for a pill instead of therapy. Is there any way or do like professionals, have you ever intervened where you would say maybe they really don't need pills, they just need counseling, and then you prescribe counseling to them instead of therapy, because I mean all these medications have side effects. I mean, I don't want to mention the medication name, like side effect is suicidal thought. Just imagine a child taking these kind of pills and having suicidal thought. I know in the comment where Kwesi said I'm asking this question because we have seen a lot of children committing heinous crimes in schools and etc. Right? These kids will be on medications and thinking of hurting somebody, harming someone or themselves. I'm trying to understand why parents will rather ask for pills that have side effects on their children that they will have to grow up with instead of going for counseling.
I mean, oh, I don't know.
Yeah,
Lady, you did.
it's for you, dog.
Okay.
It's for you.
And this is a dilemma that I deal with as a clinician, but I never do what I don't believe is my clinical best, right? So if I see a patient and I tell you like they don't need medicine, they need to go to counseling or they need to go to therapy, that's all I'm giving you. It is in my clinical discretion not to give you the medication. I am
Okay.
not going to give you the medicine just to appease you or
Mm,
just to make you feel better. Yes, I've lost patients because I refuse to prescribe certain medications.
Wow.
right.
Um, so I'm always going to do what is in the best interest of my patient, right? Because that's the oath that I took. So if that means no medicine and yes, therapy, that's what I'm going to do. But I cannot force my patient to go to therapy.
Right.
Wow.
I
Okay.
just, it's
Sure,
not, it's
sure.
not in my job description, or neither. They have their own autonomy, right,
Correct.
as a parent over their child, to do as they please with the child. The only time I can, and not really an intervention, but it's like more of like me stepping in for us to, protect the child, is when I think that there's abuse going on. So I will report it. If I feel like they're suicidal, their
Mhm.
child has a plan and an intent, but as a parent, you don't believe that they are suicidal, I
Mm,
will,
Intervene.
intervene. If
okay.
a child tells me that they have a plan and a means to do a crime and where they're going to do it, and they've thought about it, I have a right to intervene. So although the parent may not believe me, but I will intervene in
Yeah.
those situations. Otherwise, if there's no danger to others or to themselves, unfortunately, my hands are tied.
You right.
Mm,
Well, Dr. Tutu, thank you. I don't want you to feel like we're ganging up on you because
No, not at all.
it feels like we are, because because you're kind of, you said it yourself, you're in the front line, right? And
Yeah.
so we generally won't have anybody that we can ask questions like this to. So
Right.
we appreciate your knowledge and your candor.
Yeah.
Another question that I was thinking of is that how confident, I know we're all seems to be aligned in the ideology of less medication, more therapy, right? Less
mhm,
medication, more counseling. I
Mhm.
also realize and understand that there are some variations where medication is necessary in
Yeah.
a combination with counseling and therapy.
Mhm.
But how often do you find that you sometimes will recommend both, but the patient seems to be only choosing one over the
yeah.
other and not
Um,
a lot of times? Can you
Yeah,
speak to that a little bit and how you address it when you find that to be the case?
yeah, I think I would say let's do 60-40 for me to be more
Which one is the
right.
60 and which one is the 40?
So 60% of people will
Hmm.
not do both,
Okay.
right? They'll rather try the medicine first and then do counseling, because again, it's all about the stigma, right? They may not
Mhm.
feel like talking to someone about their problems or being judged about it. But as a parent, because we're talking about children context here,
yeah.
so
Mhm,
as a parent, it may just be the parent's preference not to go, and most time, uh, the parent's preference is not to go to therapy, or
sure, sure.
if the medicine would work better, then let's do that.
Um,
But yeah, but sometimes if I do feel like that they're and that's most time, I will sit down and have the conversation like, hey, this is why I'm telling you to do both, because we have seen that there's better outcomes when you do both.
Hmm.
Maybe
Mhm.
spending a lot of time in the front end, going to all these resources and counseling and taking this meds. But in the long run, it will be more beneficial for you to choose this path over the other.
Right. No, that makes it.
Mhm.
Lady, how do you address it when they come to you reluctantly, but because the doctors basically keep telling them like, don't just keep taking the pill, you got to go for the counseling, and then they come up to you with their child, or they come up to you themselves. How do you address them and making them feel more comfortable in taking the approach of the therapy more so than the medication?
Yeah, so at our end, it's just a lot of, encouragement, but being open minded to the fact that they have their own choice to make, So me as a clinician, all I can do is just encourage that, hey, this is what the doctor is saying. I really encourage you to listen to follow medical advice. By the
Yeah.
end of the day, the choice is all theirs.
Mhm.
Yeah.
Um, and this question that you brought up, Sinclair, brought something to mind that in mental health diagnoses, we do have levels, right? Which would then bring in that whole medication piece. And so for us as clinicians, when we're dealing with a patient, we're looking at how mild, how moderate, how severe
Hmm.
their mental health is.
Hmm.
So, going back to what Dr. Tutu was saying, if she sits down, she has an assessment, a client comes up with mild level of whatever they're dealing with or moderate level, chances are she may not prescribe medications.
Right.
However, if they're severe, based off of the criteria, and I'm not sure if Dr. Tutu, if you all use the DSM, but I'm sure you do, right?
We follow the DSMs in order to diagnose.
Exactly. Right. So all that stuff is spelled out in the DSM, which is the mental health Bible,
Right. But
diagnostic
there's
book.
there's also different screening tools for us to like
Right.
pull that out for that person.
Correct. Right. So going into this DSM and then finding out, whatever the criterias are, that will help to determine whether the person is mild, moderate, or severe, and then will need that whole medication piece as well. So I just wanted to bring that in to your question that you asked, Sinclair.
Okay. No, thank you. I will
Okay.
jump to the comments real quickly.
Yeah.
Hey, Amwa, Justina, go ahead and take that for me.
Yeah, so from Jay Amon, she said COP owes Dr. Tutu Mensah. So she's been on a call all weekend doing back-to-back programs. Thank you for coming. For real, yesterday was a long talk. So God bless you, doctor. That was amazing. And oh, the next question is from Mr. Okwejo Oferimensa, Dr. Tutu's better half.
Yeah, I was like, that sounds
Yeah,
familiar.
Mr. and my Mr. Cancer, he said, can the panel touch on the issues where young black kids are being misdiagnosed, especially for age? Well, that's true. ADHD and being put on drugs. Are you seeing more cases of school referrals in your practice? As parents who are lovely black children, what opinions do we have to fight back or resources we can turn to for help? Dog, and then
Dog.
like from your husband. So
From my
give it to us, and when you after that, explain it very well to him.
No, I mean, it's something we've been talking about a lot. So ADHD is one of those topics that, you know, some people believe in it, some people don't.
Can you define
Um,
that for those who have
so
no idea what it
ADHD is attention deficit hyperactivity disorder. Um, so you can be like you can just have the attention piece and not like the behavioral, like the attention or the hyperactivity or the behavioral. So it's the
Mhm.
mind and the action, right? So it's the
is.
Okay.
attention and then is the hyperactivity, the behavior that displays. Um, so in my experience, in terms of ADHD, I never put on any medication before the age of 7. Like, don't
Mm,
even come to me if they're not in school yet, for medications for ADHD.
Mm.
Um, because in order for me to diagnose ADHD, that behavior, that inattention, that hyperactivity has to be present both in the home and at school,
that's cool. Okay.
right? So everything has to like match up and align, right? And on top of that, because because of that hyperactivity and inattention, the child is doing poorly in school, right? So it's my job to really, like, I have this screening guideline where if most referrals do come from the school, like, the school come and tells the parents, oh, they're not sitting still, they're not paying attention, they're disrupting class, and they tell the parents to get a screening for ADHD, right? So then they come to my office, with this referral, and I give a thorough screening, evaluation form to the parent. And I tell the parent to give that same form, but it's more geared to the teachers, to 2 teachers that mainly interact with that child.
Right.
And then they have to bring those forms back to me. And then based on my review of those things, I make the decision whether it's really ADHD or it's just a discipline thing, or if it's more of, I get a lot of kids, like Black kids, who are maybe more advanced than their grade level, right? So they're more advanced. So when they're sitting in a class that is going over information
Good, I already know.
they've already learned, they're
We're
bored.
bored.
Mhm.
And so, like, the boredom leads to them being squirmy in their seat, not staying
Mm,
still,
mm.
or just talking to the neighbor beside them, like, because they don't want to pay attention because they
They
already
already
know
know. Gotcha.
what they're
Gotcha.
going over,
Right.
right? And so, and then sometimes the school to teacher ratio of students,
Yes.
it's high. So then it's like, well, if this one kid is always disrupting my class, then maybe they have ADHD when they really
Yeah.
don't. So
Right.
it takes, like we said at the beginning, you have to be intuitive and ask questions. And so in order to do your clinical best, because there are kids who truly, truly do have ADHD. And so my job is to find those people and
Right.
to um, put them on medication, but they're only on the medication while in school. I just want to make that clear, because they do have
Okay.
medication holidays. So like when they're home, they're not supposed to be on the ADHD medicine all the time, right? But
Okay.
there are parents who would rather them be on it all the time because it's easier to deal with, right? So
You have to feel.
it's like it's like managing, it's a bell curve, and there's extremes on both ends, and then there's those who fall in the middle. But so yeah, I think it will take more clinicians who look like us, right?
Mm-hmm. Mm, mm,
That is,
definitely.
Fact.
who look like that, for representation to be there for people of color and of different backgrounds, because sometimes the culture is also different, right? Um, yes, maybe as African kids, we can sit down still because our parents, that culturally, they want us to behave
Do you
well.
have a
No,
choice?
but it's all you have to look at all sorts of things, like
Right.
why, you have to ask yourself, like, why is this child behaving this way? Is there another reason to why they are not paying attention or maybe acting out, right? And
Right.
that will lead you to um, make the correct diagnosis. But yeah, I think representation is key.
Hmm. There's
Makes
some questions in the chat, but I want to run through because I want to ask this last question, and I want Lady E to answer. But dog, Jay Amwa said, in 2 seconds, if you can answer that. She said, clinicians incentivize act in any way to prescribe medication. And
No,
Janim
no.
says, LOL, the parents that come in during the summer and insist on med show and throw some tantrum. Why would you throw tantrum? Doug, answer that question. I have one last question for Lady E before we continue.
So wait, I just forgot. I got stuck on the last thing because I agree they shouldn't be on vacation. The parents should be able to deal with the tantrum
They should
and
be
not
able
throw
to-
tantrums in the office themselves.
Right.
But I think Jay. Oh no, there is no incentive for me to prescribe the medication. And yeah, no, no, not whatsoever. Especially, and there's a website where you can see whether your doctor has like reps coming to their office and like what. So like our medical board has put certain things in place for us not to have any conflict of interest in terms of pharmacology, pharmaceutical companies and stuff like that.
Great. Hmm. Lady E, I have this. I have to ask this question before we close. We only have 9 minutes. I know when we started talking, we did mention about you did made mention of bringing this kind of program, to the locals, right? So my question is, how can the church do better, like in addressing these kind of issues among believers? Because these kind of topics you hardly hear it coming from the pulpit, right? And then we are dealing with this nowadays. You hear kids being diagnosed with HDH, ADHD, bipolar, all these kind of stuff that, like, it really blows my mind. So how can we address these issues where we can get believers to know that these exist and these are the things that we can do to help our children?
Yeah, I guess it just once again goes back to that psychoeducation and the church coming to, I'm trying to be very mindful of my words, but just really coming to understand that once again these things exist. And so just being open minded and seeing that, people in our congregation need help because some of the kids, some of these parents, some of the parents in the congregation are experiencing some of these things. Their children are receiving some of these diagnoses, and so how we as a church body can come together to help, to be their support system, gain support from the church. So I think it just goes back to even some of us helping leadership to understand the importance and the severities of some of these things. And I just when Dr. Tutu was speaking on ADHD, like my heart just got heavy, right? Because I would want to know what is causing some of these things. And the reason why, just recently, I watched a video on how Cocomelon, a show as as innocent as
Mm-hmm.
Cocomelon, is impacting the mental health of our children. So
Mhm.
I think this is
Really?
just
You mean negatively?
excuse me.
Negatively.
Yes,
Negatively?
yes, and I'll
Really?
I'll send you all the video. Go ahead.
How so?
No, I'm saying really because, like you said, it looks very innocent. It's just
Yes.
teaching the kids their numbers, songs, and all that. And
and,
then
and,
now,
and and that's what we as parents we think, right? And so
Yeah.
that's where this education comes in. Coco Melon teaches your child to even lie, right? That whole song,
Oh,
Johnny, Johnny, yes, Papa,
yeah,
eating sugar,
that's true.
you know. And
That's
so when
true.
you pay attention, so this video, they've really analyzed even the colors, how the colors are, playing mind tricks on the kids and things like
Mm,
that. I'll send the video because obviously you all look,
yeah,
yeah,
yeah.
I am
There's a cocoa
surprised.
melon in my house. I'm telling
yeah,
you.
yeah. Honestly, after you watch it, that's exactly what you're going to say. But these
Interesting.
things
Mm,
are causing these mental health, right? And
wow.
like you said, parents like the quick fix. I'm going to sit my child in front of the TV so that I'll have time to do this thing that I
Mm-hmm,
have to do.
mm-hmm.
But then we're failing to understand that these are some of the things that are causing that whole I can never say those letters, whatever, and some of these mental health things that we're seeing in our children.
Mm.
So we just really have to be mindful. We have to be educating. us that are in these roles, we have to be educating our parents, so that we can really help to minimize some of these things, especially for our children up and coming. My kids' screen time is so minimal in our house.
Yeah.
We
Yeah.
can no,
And
Dr. Tutu,
I want to like piggyback off the Coco Melon thing. Yeah, my kids don't watch Coco Melon. That's
no,
they already know like no Coco
absolutely not.
because the quickness, if you really pay attention to Coco Melon, the screens or the view or whatever picture they're showing changes so quickly.
Yeah.
So that is promoting the inattention. So
Hmm.
it's like
Mm,
they can focus on something for just
few seconds.
seconds,
Yeah.
right? Whereas the cartoons that we used to watch back in the day when we were growing up, if you look
Mhm.
at those pictures, they're constant. Like they're kind of
Charlie
constant.
Brown.
Few
Tom
Hmm.
and Jerry.
right, a few things change here and there, right? So it's that, and that is why it's so addictive to kids. Like they always want to watch it because it's like, ooh, bright and shiny, changing constantly all the time.
Yeah,
So that is, yeah, that's the
yeah,
thing behind it. So
and
yeah,
even the content,
even the
the
content. Yeah,
content.
Well,
yeah.
I'm
Parents
glad
should
when
be mindful of that. The
mm,
content.
I'm glad when Coco Melon came, my kids were already. But I'm really shocked that I really thought, to be honest with you, I really thought Coco Melon is more like teaching kids numbers and educate educative stuff. I didn't. I mean, I guess I'm not in the medical field for me to realize that the colors, the changing of screens, and all that,
Right.
activate these kind of things. Well, parents. Oh, 3 minutes left. Oh, see, we never. Oh, the questions I have, man, you have no idea. I'm really glad we talked about it because, like Sinclair and I, when we were talking planning this show, we had so many questions, and these are questions that we really you don't think about, like mental health in kids. I mean, how can kids be diagnosed with these kind of diseases, right? And sickness and all that? It really blows my mind. And we were talking about how when we grew up in Ghana, what child had ADHD? Which child had bipolar, right? So
Hmm.
you look at the environment that you grow up in, and then here the food that we eat, and I know all these things like are connected, right? And I wish we had more time to talk about it for our parents to learn.
Can
Dog,
I
I know
say
you have something to say. 2 seconds. 2 seconds.
it's like you know how the Ghanaians say, "Oh, kids have no worries."
Hmm.
Yeah.
That that's a lie. Please check in on your kids
Yeah.
because they live in. I mean, Sister Justina was saying it like the times that we live in. There's so much availability of information and
Right.
things that we can no longer say kids are not stressed. They're stressed about who's going to talk to them or who's not going to talk to them.
Yes.
All these things. So please check in on them, see where they are in terms of like, you know, their self esteem and all these other things.
Thank you. Thank you, Doctor.
Thank you.
Tutu Mensa, and thank you, Lady E. This has been amazing discussion and conversation. I've learned a lot, and we will keep learning, and we will keep talking about these kind of topics because it's not going anywhere. I feel like as time goes on, things are now we are realizing things that we never thought of. So I just want to say thank you very much. Thank you very much to our viewers, our producers, our team behind the scene. My man,
Yeah.
Sat.
Hey, all these thank yous you're giving, I was like, don't let time run out and then we forget
Yes.
announcement.
So my
Because
announcement,
yeah,
the Shout District Youth and Pensa, we have in-person Thanksgiving event called Friends Giving on November 30th at 1 p.m. Please look out for more information from your local leaders and from your district leader at a justice. Thank you, everybody, and please do have a blessed week. And as Doctor said, check on your children, check in with your
yes.
kids, talk to them, have a safe environment where they're able to talk to
Parents,
you
be
without
parents.
judgment. Be parent and show your love, show yourself your soft side. Have a blessed week and enjoy enjoy your week. Bye bye. See you in 2 weeks time.
See ya.
Great minds, come let us reason together. Great minds, we are open to reality. Oh, we want to know more, we are hungry for more. We are curious, always searching for the truth. Great minds, come let us reason together. Great minds, come let us reason